And welcome to this webinar series. I'm Himla Sudyal, the Executive Officer for the Academy of Science of South Africa. It is indeed my privilege to give a short presentation on issues related to women in science during this National Science Week symposium. Now, before I start talking about issues related to the Academy, I just want to add that historically, women have had a very difficult time breaking into the field of science that has been dominated by males. But it took a few courageous women to fight this dominance and contribute to several fields since the first half of the 19th century. This landscape, unfortunately, is still very challenging. Issues related to women in science and issues related to gender equity live with us to this present day. How do we change this? Would it be possible to imagine a world where equality between the sexes can play out? These issues have been addressed across time with some improvements and a hint at redress for gender issues. Why then is it still so challenging? Well, we all are raised in a society where there are certain norms that are in place, and these norms contribute significantly to the presumed roles for men and women. Women seem to be far more affected by cultural norms. How women are raised start with the girl child and how the girl child transcends through adolescence to becoming an adult. There are differences in customary practices, for example, cultural rituals associated with prayer, with marriage and death. Women are treated differently under these scenarios. Working mothers have to be multitaskers, almost like superwomen, playing the role of caregiver, provider for the family, the person who coordinates and conducts domestic chores, the raising of children, looking after entertainment, homework, and to name just a few. In fact, in some parts of the country and elsewhere in Africa, women are also the agriculturalists, planting crops, maintaining them, and ensuring food security in the home. It is against this kind of backdrop that women enter the workplace, with societal views already entrenched in the minds of male counterparts, and to some extent, the submissiveness that women experience in the work environment. Now, how has all of this contributed to the Academy of Science of South Africa? As we know, the Academy is a system that is based on membership, and membership represents those individuals who have performed at the highest level of excellence while contributing to societal challenges. Membership is not one that based on selection, but based on election. Current members have to nominate. There's a process of nominees, applications being reviewed by experts in their disciplines, and then a short list is presented to council for deciding where the cutoff would be before the names of candidates are put onto the ballot. Members then vote, and following this voting process, new members are inducted into the Academy. So since the onset of the Academy from 1996 to present, and as of the 31st of March this year, the membership of the Academy has grown to 594 individuals. In fact, these numbers have changed subsequent to the date aforementioned due to deaths of some members. But let's work with the 594 members. Of these, only 168, that is 28%, are women. And in the last 5 to 6 years, the statistics we have with respect to our growth curve for the number of females to males In fact, in some cases, the number of women that we have inducted has been almost equal to that of men, and in some cases higher. With the help of one of our council members, using the current data that we have, we estimated that using some growth statistics that we would expect parity of the number of males and females to be reached in about 25 to 27 years from here on.
So I was born in the UK. My parents are both Welsh. My mother came from a Welsh Methodist background in a small rural village, and my father from the Welsh mining valleys, from generations of trade unionists. So we were brought up, my sister and I were brought up in a family where there were quite strong principles about doing right for your community and doing good, and very strong work ethic. And so I think it was probably my mother who always wanted to be a doctor and never had the opportunity because of the Second World War. She, I think, influenced both my sister and I, we were just two sisters, to become doctors. And I think because we didn't have brothers, we got a lot of energy also from my father, who himself became a computer scientist in his later career. So I think that it was a hard-working family where everybody worked, and where what you were expected to achieve and to achieve in academics, and enormous pride. I think that Welsh background, enormous pride in terms of academic achievement. So that was part of it, but I think the other part of it was that that framework made me, from a very early stage, even when I was at school, into an activist, with a very strong sense of what's right and wrong in society. And obviously that took me into the anti-apartheid movement in the UK in those days, and various other sort of activism issues around the health sector as well. I can't remember the point where I wanted to be a doctor, but I think my mother was a very strong influence. I think there were books around the house, very old books on medicine, which I can remember looking at with great interest about surgery and things like this. But it seemed like a career which was both very satisfying from what you could see. It had professional status, which for my parents was important. They wanted us, my sister and I, to be professionals and to have that kind of career path. But it was also a career where you could give back to communities, which I think just suited the sort of environment in which I was brought up in. Well, I think very influential for me was going to work in Zimbabwe immediately after independence, where I worked in Harare Hospital as a pediatrician, at a time where the country had gone through, an extraordinary war. And as a pediatrician, I was seeing so many children who were malnourished, with many diseases that were killing them, malaria, things that really shouldn't have been affecting children as we saw it. So that was very, very, really made a huge impact on me. And then coming to South Africa with my South African husband then in the 80s, and working in Alexandra Clinic at a time where we didn't have government funding. There was very little interest in supporting the needs of the township and the township health services, and we got funding from donors and tried to provide the best services that we could. And again, I was in charge of the pediatric services there in Alex, and again, had a huge impact on me, including being in Alex at the time of the 1986 internal war that occurred in Alex, and hiding the youth in the clinic, looking after youth who'd been injured and so on. All of that just made me feel very strongly about the wrongs that we had here in South Africa. And then I think finally having the opportunity to set up what was then RHRU, a research unit here at WITS with just 5 people, and being asked to actually answer some of the questions initially around women's health that were going to impact on the policies of a new democratic South Africa, and that rapidly moved into the HIV field and the sexual and reproductive health fields. And so I think those three things allowed me to combine my activism and my career as a doctor and then later as a scientist. I think many people will say in their careers that they have different, on average you have about 3 different career chunks in your life. I think as a doctor, the first part of my career was certainly clinical medicine, which I really enjoyed, and I think that transition from a medical student to becoming a doctor is hugely satisfying, that you're doing what you've studied for many years to do and you're caring for patients. So that was fantastic for me at the time. And then moving in post-94 into setting up a research unit, very modest and small at the time, and which has now grown into a 2,000-person research institute at the University of Witwatersrand, predominantly young women scientists. And then the sort of move there where I am, the space I'm in now, which is obviously a space that's giving me huge satisfaction because it's combining that early clinical experience, the activism, the research experience, building up an academic entity, and that's in terms of global health and policy, contributing to the national policies, not only in COVID, but the Drug Regulatory Authority, but also now contributing to global health, thinking into the future around, pandemics, thinking about vaccines and vaccine access. That for me is hugely satisfying because of my experience here in South Africa and working in the African region as well. I feel that I'm now able to pull all those pieces together and really advocate for the needs of the African region, for low middle income countries, for people in less well-resourced settings, but have the sort of breadth and the depth of knowledge from different areas of my work in able to pull that together and I hope contribute. Well, at the time when I might otherwise have thought about having a doctorate, there were several things. First of all, I was a clinical doctor, and in those days, clinical doctors didn't think as much about having a doctorate. I wasn't then. I was an activist and a clinician, and I wasn't thinking about research in the early days. And then the second thing, which is something for many young women, and it continues to be an issue, is that I had 3 children throughout in the 1980s, and all the time that goes into not only having those children, but caring for them, bringing them up, contributing to their lives as well, meant that, I had a doctoring career, a mothering career, and it just wasn't on the agenda. And then the moment passed, and it was only now that when you reflect back that I can think, yeah, it would have been really good to have done a PhD, but that wasn't the environment that I was working in. But I would certainly say to anyone who's now a clinician and interested in research and interested in this kind of career path is definitely do your PhD. And my daughter is such a doctor, and I've said exactly that to her. Well, I think that for ASAF, I've really, I've seen how ASAF has grown in the last, 20 years that I've been associated with ASAF. But in particular here, I've now really recognizing the importance that ASAF, as a South African institution, is placing on women in science, but also the African institution as well is prioritizing women in science, and also the growth of women scientists and African scientists as well. So I would say let's do more of what we're doing. And try and sort of see if we can mainstream the thinking more into, say, girls in schools, so that we can actually just influence that ambition and give young women the confidence to pursue a career in science, or in my case, in medicine. So when the pandemic was really just emerging, before we even had the COVID-19 name for the disease, and we hadn't defined the virus. I was asked to go to the World Health Organization to a very large meeting where we talked in a big virtual conference to the Chinese scientists to hear what they were going through. So at the end of that meeting, which had a lot of international scientists present, the news came that this disease was going to be called COVID-19. So from the outset, I was involved with WHO and later on with the COVAX facility, which is called, which is an international effort to try and get vaccines to low middle income countries who wouldn't otherwise be able to negotiate vaccines for themselves. And also with an international organization called CEPI, which stands for the Coalition of Epidemic Preparedness. And with that, I chair their scientific advisory committee. And very, very early on, we had an emergency meeting of that science committee and said, here's this new virus. Do we divert funding? We were funding a lot of research into other vaccines for other pathogens that might cause epidemics. And we suddenly said, do we now divert funding into this brand new virus? And we said, yes. So very early on, we were able to divert funding into vaccine development, and some of those vaccines are now those that we see that are being rolled out in the world. So globally, that was the sort of start, and I've stayed very involved with the global dialogue about particularly COVID vaccines, but also working with WHO on their emergency committee for COVID as well. So that's global. At a national level, I have obviously the WITS RHI has developed and very rapidly developed a huge research agenda on therapeutics and vaccines and serosurveys and vaccine hesitancy. So a very diverse multidisciplinary research agenda and really rolled out incredibly quickly. So is a major player in the COVID research, not only in South Africa, but globally. But I've also been serving as an advisor to the Ministerial Advisory Committee and the Vaccine Advisory Committee, and also chaired the board of SAPRA, the regulator. And in all of those portfolios, COVID has had to come first and foremost in terms of our agenda. So I have been privileged to feel that I can contribute through all of those vehicles as part of a team, very much as part of a team in each of those settings. Well, I think something I'm extremely proud of was with the leadership team at WITS RHI here, is that everyone, all of the directors, all of the senior researchers and clinicians, all literally turned and within weeks became researchers in the COVID field, whether it was clinical trial research or epidemiological research or social science research, or delivering services in support of the COVID response. Everybody has turned their hand and worked extraordinarily hard. And this has made WITS RHI one of the leading research entities in South Africa in the field of COVID. So that I'm very proud and very grateful to the team for. But I think, to say proud moments when you're in the middle of a pandemic is a bit tough. I think feeling grateful, it's very much working as part of a team, whether it's with SAPRA or the Ministerial Advisory Committees or with WHO structures, feeling very, very grateful that the world has got so many excellent scientists who are all focused on trying to find solutions. I think, like many people, I think you get comfort from your family support and structures, your friendship supports and community support, huge comfort from that. But I think also just comfort from seeing the responses. Has the response in South Africa been perfect? No, of course not. It hasn't been in any country, anywhere in the world. Has the global response been perfect? No, certainly not. We haven't got vaccines out to the poorest countries. But I do feel that the push is around the importance of equity, of access for people who are in the poorest communities to get access to vaccines and therapeutics and good care. that has comforted me, that there are so many people who are pushing and advocating for both services and vaccines around the world. Well, I think that the first thing we would have to reflect on was, were we ready for this pandemic? In some ways, I've been part of structures such as CEPI, where we were planning for the possibility of a pandemic virus, and we're investing in vaccines and vaccine platforms. So, you know, that was sort of preparation, and we were able to invest in vaccines, but and also working with an organization called Gavi, which is the Vaccine Alliance, the Global Vaccine Alliance. And again, they have been able to turn and really invest their time and energy into the COVAX facility, which is trying to purchase and get vaccines to the poorest countries. But I think in all of those examples, and in our readiness, even in South Africa, I think that we will learn to be more research ready, to have more tools on the shelf that we can take off, such as the development of new vaccine platforms that can be quickly adapted, the importance of having manufacturing facilities so that the African region doesn't get left as the last region to get access, and the importance of surveillance. You know, I work closely with the WHO in the African region, and we realize how weak across the whole region our surveillance has been, and how good the surveillance has been in South Africa. And we need to improve surveillance across the board if we are going to be ready for future pandemic outbreaks. Well, I'm very fortunate because I have a very close family. My husband is also, you know, I met him because he's an activist, so he's as busy as I am, also a doctor, but really looking at many of the problems that are confronting South Africa at the moment. So we hang out a lot, and I'm fortunate that my adult children, their partners, I have a grandson, are all here. And they're all really good fun, and they make us do things that we might not otherwise do. But also just fortunate still to have friends. We don't obviously see people as much as we'd like to, but we do things. We go hiking, we go walking, we go dog walking, and just, you know, personally, I enjoy exercise, so I've managed to keep the gymming and the swimming going throughout all of this, which for me is very important. Well, I think the first thing is to acknowledge that if you're a woman at home and you have to be pregnant and you're breastfeeding and so on, that there will be times in your career where you're not going to be you cannot be fully focused on an academic career, a clinical career, a scientific career. And we need to make more allowances for that, because at the moment women are significantly disadvantaged in the career space by the time that has to be taken with that. It means that we should give women more time to do PhDs, that their career mustn't be closed down at 35 because they've had to take this kind of time out. But I think if we go back and we turn the clock back from that point, we need to invest much more in science education in schools for both girls and boys, so that science careers become really exciting and really interesting. We need scientists. The world needs scientists. We need clinicians, we need doctors, we need all the allied health professionals. So we need to invest in that. And then we need to really invest in young women, particularly when they get into tertiary education, to have belief in themselves, so that they don't feel that they don't deserve to be there, or they don't deserve a promotion, or they don't deserve a job, or they don't deserve a qualification. That women must start to really believe in themselves, and we must promote that as well. Well, I think the first thing is to say we'll say young girls, these can be from a very, very young age, that you have to be able to say to girls that you can do what you want, that actually everything should be open to you, and there should not be obstacles. And if you feel those obstacles or you're experiencing obstacles, you need to speak out. We're hearing women, and young women in particular, more and more speaking out about some of their experiences that they've had to have in the workplace, and including in terms of sexual harassment and so on. So young women need to speak out about what is right for them and what is wrong for them, and we need to give women the space to do that. But in terms of saying to young women who want to be a professor, I mean, you know, if you ask my kids, what I've always said to them is, you have to work hard. There is no, unless you're brilliant, most of us are average with certain skills. You have to work hard to bring out those skills you have, and have extraordinary dedication. And even more so now, because the academic space is increasingly competitive. So work hard and work out how you're going to do that. And then if you have a family, if you choose to have children, work out something, a way of living that works for you. If you have a partner who's supportive, work that out with your partner. But also work out what is going to work for you in terms of both your academic work, your day job, and the time that you need for your family and for children. Work that out and actually give yourself the discipline to do that. That often helps too. Well, I think at this point in my career, probably three things. The first would be to have supported the careers of other young, emerging scientists, clinicians, particularly women scientists. WITS RHI is predominantly a female space, which we're very proud of. We do have men and we support them too, but I think particularly being able to push the careers now of other emerging scientists and clinicians, and that WITS RHI should be known for that. That I would be very proud of. The second one would be, as I say, at this point in my career, would be my contribution to health policy and to global health, because I think I've served on many committees now and have been able to, I hope, contribute to global thinking around not just research and development and science and vaccines, and not just that, but also the sort of framework of thinking that we need for the African region in particular, and for low middle income countries. And I think my combination of experience has allowed me to really put the voice of what's needed in less well-resourced environments to the forefront of the research and the policy agenda in terms of global health. And the third thing I would want to feel remembered for is being being a good mother, being someone that my kids like, I hope, and I like to hang out with, and also being a good partner to my husband for many years, but also being, I think, friendship and contribution to community, because especially in the field of medicine, a lot of what you're trained to do is to give back at an individual level to patients in the first instance, but also for the community good. And I'd like to be recognized perhaps for having been able to give something back into the broader community.
I'm Dr. Phyllis Kalele. I'm the Senior Liaison Officer, African Partnerships, and I also lead the Women in Science initiatives at the Academy of Science of South Africa. Just over 30% of researchers all over the world are women. And if there are not enough women as researchers and scientists, we lose the scientific knowledge and also the local knowledge that they can contribute to science. In order to increase the participation of women in science in South Africa, ASAF hosts a number of initiatives that are helping to ramp up the number of women who become scientists. An example of such an initiative is the Organization for Women in Science for the Developing World, the South Africa National Chapter. OWSD, in short, is an international organization that is based in Trieste, and it is also a program of UNESCO. Another initiative that the Academy of Science of South Africa hosts is known as Gender Insight, GIS in short. Gender Insight is a global, multi-sectoral, multi-stakeholder initiative to promote the role of women in science, innovation, technology, and engineering. Gender Insight in short. It aims to promote awareness amongst decision makers at all levels that science, innovation, technology, and engineering for development policy and programs will be more effective, equitable, and sustainable when a gender lens is applied. That is, when they reflect the vision, aims, concerns, perspectives, knowledge, and abilities of both women and men. For more information on the Organization for Women in Science for the Developing World South Africa National Chapter, please visit www.owsdsa.org.za. For more information on Gender Insight Africa Regional Focal Point, please visit www.genderinsight-africa.org.
Hello everyone, my name is Professor Helen Rees, and I've had the honor to talk to people about women in science and women in medicine. And I want to say to all the women out there, but also to all the men, Happy Women's Month. Let's think about women's potential during this month. And also, let's think about the National Science Week as well. Let's think about science as a career and the importance of getting science into schools, so we're giving opportunities for both girls and boys as they start to think about what their future might look like.